What are the clinical breast exam guidelines for breast cancer screening? Imagine a healthcare professional gently examining your breasts and nearby areas to check for any unusual lumps or changes. That's called a clinical breast exam. It involves feeling the breasts, underarms, and collarbones to find abnormalities that might indicate breast cancer. But when it comes to screening, guidelines about how often and for whom these exams are recommended vary and are evolving. For women who are at average risk of breast cancer, meaning they have no personal history, no strong family history, no known genetic mutations like BRCA, and haven't had previous chest radiation, the current consensus is that routine clinical breast exams are generally not recommended. The American Cancer Society states that there is not enough evidence to show that these exams reduce the risk of dying from breast cancer. They also point out that false alarms can lead to unnecessary tests and procedures, which can cause anxiety and harm. The U.S. Preventive Services Task Force, a major health authority, says there is not enough evidence to determine whether clinical breast exams help or harm women when used as a screening tool. Instead, they focus on mammograms, which are supported by strong evidence for early detection. They recommend starting mammography screening at age 40 and doing it every 2 years until age 74. Some organizations, like the American College of Obstetricians and Gynecologists and the National Comprehensive Cancer Network, suggest that clinical breast exams might be offered every 1 to 3 years for women aged 25 to 39, and annually for women 40 and older. But they emphasize that these decisions should be made together with your healthcare provider, considering your personal risk factors and preferences. For women at higher risk, such as those with a strong family history or genetic mutations, clinical breast exams are usually part of a comprehensive evaluation. These exams can help identify any concerning signs early, alongside other screening methods like mammography or MRI. It's important to remember that mammography remains the main tool for early breast cancer detection. While being familiar with how your breasts normally look and feel is encouraged, called breast self-awareness, routine self-exams are not officially recommended as a screening method because evidence shows they do not significantly reduce death from breast cancer. In summary, for women at average risk, clinical breast exams are not routinely recommended for screening. Instead, focus on regular mammograms and stay aware of any changes in your breasts. Always talk with your healthcare provider to develop a screening plan that fits your individual health profile. Remember, guidelines are based on current evidence and can change as new research emerges, so personalized medical advice is key.